on. Super excited. Once again, I want to thank Dr. Maharaj and Phil, who are running this ship. I really appreciate you guys' time. Guys, they've made themselves available. This is the third time that they've made themselves available. So it's just fantastic. So I'm just going to turn the call over to them, and let's continue to learn. Thank you so much.
All right. Thanks, everyone, for allowing Dr. Maharaj and myself to be with you today. It's a thrill. It's a privilege. We are going all in with all of you in ACN. You're going to see healthcare really is going to see the power of direct selling, how it can have a positive impact, pun intended, in healthcare, and the value that we undoubtedly provide these individuals, these families, these small businesses, and these seniors. And typically healthcare sharing, if you don't know, it's the alternative to high cost of health insurance, about 50 to 70% less. So significant savings that people get to experience. And so that's the great part, the fun part that you get to help us impact America on, and that's to deliver them undeniable value in that way. So healthcare sharing, for any of us that participate in it, it's voluntary. It's based on the monthly contributions of its members. So people say, well, there is no guarantee with healthcare sharing. That's right, because the entity of Impact or any other healthcare sharing organization is not paying its bills. It's dependent upon and relying upon the power of the individual people to monthly voluntarily contribute to their account. So it's a risk versus reward concept, right? I'll risk the no guarantee, and I've talked to plenty of people that have had insurance that had a so-called guarantee that didn't have all of their claims paid. So be careful what is promised, because it's not always delivered in health insurance. But the reward, though, obviously 50 to 70% less. That's what you get with us. And I would say what healthcare sharing organizations need is that to grow their membership, right? ACN is the best direct selling organization in the United States of America that can onboard customers very, very rapidly and at the need of a healthcare sharing organization. Here's the good news for you as a prospective member. We're already in good shape fiscally, what we have. In fact, so much so that last November and December, we didn't ask our members for nearly about $625,000 because we didn't need their money. We had such good reserves that we didn't need it. And I've been told we are the very first healthcare sharing organization that has ever done anything like that. So very, very proud of that. Here, that's the good news. You're getting a fiscally sound organization that has processed with Dr. Maharaj's team over 20,000 medical bills already. So this isn't a startup, okay? This is warmed up for the success that I know all of the ACN IBOs will be bringing. And so, so just excited about that. Some key things that you should know about healthcare sharing is we're a not-for-profit entity. So I don't have the typical conflicts that a for-profit health insurance company does, right? We can be member-centric in that regard. In fact, when you look at when we launched in January 2020, and you look at our offering now, we have added millions of dollars in costs in order to be member-centric. I didn't have any shareholders that were fighting me on that, right? I had a board of directors that approved it because we are a member-centric organization. I'm not, Dr. Maharaj's team is processing bills in 19 days. I don't have a for-profit board of directors that says hold that money and fight with those providers as long as you can, because that matters to our balance sheet and that matters to our quarterly reporting for our shareholder price. All that goes away, right? I don't have we're paid fair market value salaries. There's no $500,000 or $1 million salaries in this organization. We have to justify fair market value salaries. And so you should feel very, very good about an organization that is built that way for healthcare. in this not-for-profit, because it is a difference maker. We can look for ways to continue to add value to our members because we don't have those conflicts or those constraints that for-profit entities do in healthcare. And that's a difference maker. The Department of Health and Human Services says about 5% of the population account for nearly 50% of all the healthcare spending that occurs in this country. What does that mean? That means the vast majority of people are overpaying and not using something that they really don't need. And so Income's healthcare sharing specifically impact to help and deliver value to those individuals, to those families, to those small businesses, and to those seniors that need it. Our price points, we have over 800 different price points, right? But they begin for an individual at $65 for a very comprehensive program. And Dr. Maharaj is going to unpack some of those key features and benefits in just a few moments. And then for families, beginning $330. Okay, this is again delivering that 50 to 70% less than what you see in the Affordable Care Act in the marketplace. It's a comprehensive program, as we mentioned, right? So we things like preventative services, maternity, accident, illness. We have free telemedicine, right? Industry leading prescription drug pricing in that regard. So as the Department of Health and Human Services stats says, who are we looking for? Well, we're really looking for the vast majority of the country that are overpaying for something that they rarely use, right? That are fairly healthy to healthy. That's who our customer base is in that regard. We see that is about 91 million people today between the first bucket of the individual market, non-group, people that don't have access to affordable health care through their employer, the gig workers, right, in this country that are doing exactly what you're doing. And that continues to grow rapidly. The quit rate is at an all-time high. Between that bucket, between the underinsured, those that have, high deductible skinny plans, and between those that simply just are going without insurance, those three buckets combined is about 91 million people. So a lot of opportunity to not only help them, but ACN has put you in a position to win with us and Impact. You can help yourself along the way, and there's nothing wrong with either one of those components. I know, was it James Adlam, right? Called it conscious capitalism, right? I love that. And that's exactly your position that you get to do in that regard, is to truly help yourself by helping others. And what a great way to serve the country that is in great need, because 80% right now of families are saying the number one reason that they're trying to do is lower healthcare costs. The number one, 80%. So your market opportunity is just overwhelming, quite frankly. And we're in an inflationary period. There's debate whether it's going to be stagflation, and there's discussion, debate about recession or depression, right? So I say whatever Asian or Eshin happens, what typically follows is unemployment, right? Again, more people looking for affordable healthcare, needing access to affordable healthcare. And you, through ACN and us, help save the day for these individuals, families, small businesses, and seniors. Small businesses, right? They have their own challenges right now. They're looking for ways to retain employees because of the quit rate being very, very high, at an all-time high. And so now they haven't been able to afford to have traditional health insurance because of the cost. It's outpaced inflation and earnings over the last decade. And so, but now with a solution like ours, we can partner with them, and employees can get access to affordable health care. And here's the cool thing with us: if they decide to leave or ask to leave employment, they get to take their Impact membership with them. So it's portable in that regard. And that's a very, very powerful powerful aspect. Healthcare sharing memberships have grown over 1,000% just in this last decade alone. And they've grown primarily with very good healthcare sharing organizations, but they're religious based. Okay. Nothing wrong with that. They're very good organizations. They just, they're just restricted on who they allow into the community. Okay. You have to be of a particular faith. And in some cases, you have to get a signed affidavit by your pastor, priest, or whatever before they consider allowing you into the community. And so, but they're good religious-based healthcare sharing organizations where we're vastly different. One of the key differences on Impact versus our other good brother and sister organizations is how we're architected, how we're built. We're an ethics-based healthcare sharing organization rooted in the love thy neighbor faith ethic. And so that allows us to welcome all races, all religions, all colors, and all creeds into our community. So big difference. The other key difference too, how Impact is you're used to insurance, right? Sending in a premium to a for-profit company. That insurance company takes your premium, whether it's from you or your employer, and puts it into their balance sheet. They create a big balance sheet, right? Not so with Impact Health Sharing. We decentralize our approach with healthcare. So you open your own member account, okay? You fund that. You pick the day, you fund that monthly because it's a prepaid product, okay? You give us permission only to pull the administration fee and the program fee, which pays the vendors, including our newest marketing partner, ACN. The remaining balances remain in your account, your member-owned account. So when you're matched to an eligible medical expense, it's all done through technology via algorithms. You're notified. You got 3 days to participate, and then that little bit of money is pulled out of your account and others, and then sent to the provider. As I said, Dr. Maharaj's team is doing it in 19 days right now. Because again, we want you to be looked at and viewed as a good customer when you go to your provider in that regard. So a big key difference. We were the very first healthcare sharing company in the United States that launched this decentralized peer-to-peer member-owned account. So for the first time in healthcare, very first time in healthcare, you see how 100% of all the monies are moving in an organization. And so again, we were very proud to be the first to deliver that level of transparency in that regard. So I'm going to let Dr. Maharaj talk a little bit on a few things, and then I'm going to come back and talk a little bit about the process that's going to begin on Monday, May 9th of registering your lead. So with that, take it away.
Thank you. Hello, everyone. Just want to start off by saying with Impact Health Sharing, we really have two provisions that I want to touch base on. The first one being our sharing provision, where we share into, our members share into eligible medical bills for other members. And the second one that a lot of you may not think about right off the bat is our savings provision. And so once we receive a bill, we look at what we consider fair market pricing for that medical expense. And how we determine that is really based off of demographics, where you're located, and then obviously the diagnosis and the procedure codes, and ultimately what the federal government reimburses for that same exact procedure in your area through Medicare. And we don't just say we're going to pay you the Medicare rate. We actually recommend paying above that. So that's how we determine our repricing model. And we reprice all bills, regardless if they are eligible or not. All medical bills are reprocessed. So let's say you have a medical condition that may not be eligible because it's related to a pre-existing condition. That bill will not be eligible for sharing. However, it is eligible for savings. So we will take a look at that bill, reprice it. A lot of times we're seeing savings of 50% or more in some situations. Providers, believe it or not, and facilities bill astronomically above what is fair market pricing. In a lot of instances, we're shocked every time we see it ourselves. So we reprice that. over 98% of the time, they are accepting that repriced amount. And in the cases that they're not, we reach out to them and try to get those settled accordingly. So that's a great two things to remember when thinking about impact health sharing. In addition to that, I just want to highlight a couple things that I believe helps us to stand out when comparing us to other health sharing organizations, but also to traditional insurance. I believe that we are better in many instances. We do share into wellness visits. We don't share into them. We pay for your wellness visit, your one annual physical that you get once a year that we all should get. So your provider makes sure everything is going well. If you happen to have something, at least they're finding it early enough where they can intervene, knowing that that will help to improve your outcome ultimately. So that visit is 100% paid for by Impact's members. So the day you sign up, the very next day, you can go get your annual physical. We pay into that. We share into that rather at 100%. In addition to that, usually when you see your healthcare provider for your annual checkup, more than likely you're going to get a prescription to go get some blood work done. And so in addition to sharing into your annual physical at 100%, we're also giving you $150 to use towards getting those routine labs that your provider usually wants you to get, things like cholesterol, your chemistry, those sorts of things. So you get that, that's included in your membership. In addition to that, we do share into therapy. So every member gets 50 visits they can use for towards the following. You can use it towards chiropractic care, physical therapy, occupational therapy, respiratory therapy, speech therapy, as well as cardiac rehab. And a lot of traditional insurances don't share into chiropractic exams, and they even have extremely limited benefits when you look at like physical therapy, speech therapy. So you get 50 visits per member per membership year. So if it's you and your spouse, you get 50 visits, they get another 50 visits, and that resets annually at your membership annually every time. So you get that reset. In addition to that, a lot of traditional insurance companies, as well as healthcare sharing organizations, don't always share into home healthcare. We do. And we share into 40 visits that you get per member per membership year. So again, same thing applies. You get 40, your spouse, your dependents, they each get 40 visits. So heaven forbid you end up in the hospital, you have a stroke or some sort of accident, you need some help and attention at home. We share into those up to 40 visits. We also share into, well, not share into, but we have free telehealth, which I believe is an amazing provision. I truly believe that because I use it. So you use our preferred provider, log into your portal, and you get to see a provider completely free of charge to you. It's great for things in the middle of the night or things that you don't necessarily need to go leave your work day and see a provider for, but it is urgent enough that you need it to be addressed. They can send a prescription right to your pharmacy. So it's really great, especially in today's times. If you have children in the middle of the night, 3 o'clock in the morning, you may not need to rush off to the emergency room or to urgent care. But it is something that maybe can't wait till the next day. You can log on to our telehealth provider, let them see your provider, see your child rather via telehealth, and they can send in whatever prescriptions you may need. Recent enough, I did use this. It was very helpful to me. I've been dealing with a little bit of a chronic sinusitis, and I needed to see a provider. I didn't want to take some time off from work because we've been busy preparing for you all. And so I logged right on, got my telehealth visit. And then it got me thinking. So about a year or so ago, I used telehealth through my husband. We had regular insurance at the time. And I assumed that we had free telehealth because I know Impact had it. I know that, you know, with COVID, a lot of other insurance companies were offering that. And it was with the same provider that we use at Impact now. And I ended up paying $85 out of pocket because it was not covered. Yeah. So that was an $85 savings right there, right off the bat. In addition to that, we do also share into mental health. A lot of traditional insurance companies do not share into mental health. We understand that it is an issue. And so we do share into that. You get virtual mental health visits. We share into outpatient mental health. If you need to go see a counselor or your psychiatrist, we do share into those as well. We have industry leading prescription savings plans, as Phil mentioned, which I do believe is industry leading. And in comparison to traditional insurance, our rates do far exceed them in many instances. I've given the example that I recently had to pick up prescriptions for a family member. They weren't well, so they asked me to stop by Walgreens, pick up their prescription. There was 2 of them. So as I'm waiting in line, I just decided to pull up our prescriptions plan to kind of compare the cost. And in one of them, I believe it was like a savings of $10, and the other one, it was about the same. So $20 savings right there with 2 prescriptions, and they weren't that expensive to begin with. I think one was like 20 something dollars. The other one was about the same. So not expensive overall, but to know that our prescription saving plan would have far exceeded that by $10 each, that's a $20 savings right there. So really great offering that we have. Also just wanted to highlight our maternity benefits. Our maternity provisions. We do share into maternity. You do have to be a member of Impact Health Sharing for a total of 12 months in order for us to share into your pregnancy. So let's say you're an Impact member, you've been a member for 3 or 4 months, and then you end up getting pregnant. By the time you deliver the baby, because we go based off of your estimated due date, you would have been a member for 12 months because you're pregnant for 9, you've already been a member for 3 or 4. We share into $150,000 from any single pregnancy event, and that's repriced. And as I mentioned before, we're seeing savings with our repricing model, sometimes 50% or more. So when you think about $150,000, that's a reprice rate. So I want you to keep that in mind. The actual billed amount could be over $300,000 or more. Yep. So just keep that in mind. In addition to that, we're always trying to be as member-centric as possible. And because our reserves are so healthy, we can start offering a little bit more. We take feedback from our membership very seriously, and we're constantly trying to improve and bring new features to our program. So one of the things that we heard and we listened to and we understand was starting May 1st, before we had newborn babies that they were included in that $150,000 provision for the mother. We have since removed baby from that because we do understand, heaven forbid, if the baby requires NICU treatment, those bills can be pretty pricey. So we removed the baby from that $150,000. So now they are seen as any other member. However, any other member that joins Impact Health Sharing, within the first 60 days, we limit our sharing amount to $50,000. And again, that's repriced. So that $50,000 is going to take you pretty far. But with babies, the first 60 days of their life in the NICU, they can accumulate a large amount of bills. And so we didn't want to limit that. So we removed that provision for newborn babies as long as they've been added within 30 days of birth. So we heard that, we are changed it, and we are constantly changing things again. And we have the ability to do so, one, because we're not for profit, and secondly, because our reserves are very healthy. So that's something that you should take into consideration. Remember that what we have now, it's only going to get better from here on out.
All right. Thank you so much.
Thank
yes,
you.
A great example of a comprehensive healthcare program, right? That is becoming more and more member-centric. As we become more fiscally sound, we can do exactly what we've been doing, giving members money back, expanding the features and benefits of Impact Health Sharing. So very, very proud. So what's going to happen, and what can you do now to put yourself in a position to win on Monday, May 9th, is get accredited first. Okay. You can do that right now. ACN, Compass, go to product, select Impact Health Sharing, get accredited. Don't share that link because that link is tied directly to you. So we've had people forward it, and that breaks the system of record, if you will. So yeah, you can go on and get accredited. We don't want you to be healthcare sharing salespeople or experts, but we do want you to have a general understanding of what it is and what it isn't. And so 9 out of 10 questions you got to get right? So 90% pass rate in that regard is what we're looking for there. And then beginning Monday, May 9th, you're going to be able to register your lead or them through your personal website. And here's what's going to happen. Our team will call them, send them a text, and email them referencing you as recommending that we as Impact Health Sharing call them so we can talk to them about reducing the high cost of healthcare for them. And then we're going to report statuses on where that lead is. So all that's coming and going to be talked about next week on the RC and above call, I think it's called. So that's the good news, right? You don't have to be healthcare sharing salespeople. All you need to do is simply find out and have a conversation with, are you open for ways to evaluate your high healthcare costs? If the answer is yes, or if the answer is no, listen, my employer pays 100% and I'm great. Great. You're one of the lucky ones. We wish you well. But we're looking again for the fairly healthy to healthy that pay some or all of their healthcare costs. We believe we can help them more times than not reduce the burden of this high healthcare cost. So yeah, Efren and Dean, that's the process, is to just Monday, May 9th, get accredited now and get as many people as you can so you have a general understanding. And then don't download your phone contact list. We want you to talk to people and give us qualified leads, because if we're overwhelmed with non-qualified leads, that hurts everyone. And so we don't want to put anyone in that position to do that. So we just simply want to find out if they are open to evaluating ways to reducing their healthcare costs. And if the answer is yes, let us talk to them. And then we'll report the status of where we are in that process. So gentlemen, it's been awesome. Is there some questions, comments, concerns, anything you think of that you'd like us to further unpack or talk about?
Yeah, so let's back up a little bit. So in the meantime, could you guys scroll down? There's a few questions that have been asked, but just to be clear, right, because everybody's writing down and taking notes. Are there any other scripts that you suggest besides that one? Are you open to evaluating ways to reducing your healthcare costs? Any other thing, any other scripts, any other suggestions that somebody can say to pique their interest?
We're going to unpack some ways. We're working actually with ACN Corporate about some other ways, maybe because pricing is so easy to get, right? Maybe sending them pricing if you're having a conversation with them. Say, hey, what's the oldest member of your household? And then figure out what the PRA that they want, which is similar in concept to a deductible, and find out how many dependents. Literally in 10 seconds, you can have a price for them. And you can text them that, you can email them that, you can be right next to them and show them and tell them. But we're working on ways with ACN to see what is going to be incorporated in phase 1 versus other phases. But yeah, at the end of the day, as we said, 80% of the U.S. household adults ranked lowering healthcare costs as their number one priority, their number one concern. So
I know
anything around that phrasing, I think, will help you.
I was just going to say, I know one of our leading sales individuals that we have with Team National, she used to start off with, what are you doing for healthcare? Yeah. And that was her in, and then go from there. And she would ask people that were coming to do work on her home or people she met at the gym. And she was getting a lot of success with that, because oftentimes say the plumber or maybe a small business owner and they don't have health coverage. And then they're saying, well, actually, I don't have anything. And she's like, well, really, let me give you a quote. And like Phil said, you can pull it up in a few seconds. And then she would email it to them and then follow up with them, maybe the next day to talk a little more, or send the lead in for us to reach out to them. So that was she found great success with that.
Yeah. Yep.
That's great. Okay, cool. So let's go down the list of questions.
All right.
So the probably the most common one that I've gotten, because we do have lots of people in California, the question regarding the California and taxes. Remember this come up before? Did we get an answer?
I haven't. The only response is we're not insurance, right? So we can't say we are insurance in that regard. You do have a comprehensive healthcare program. I would encourage you to talk to your accountant, your tax accountant, on how you want to address that. But I know there's many healthcare sharing organizations operating in the state of California in that regard.
Yeah, so I'll just add to that, guys. So yes, talk to your accountant. Back when I lived in California back in 2009, when we were on a health sharing company, we had it from 2009 all the way up to 2016, and we had no problem back then. So anyway, talk to your accountant. But I filed taxes no problem in California with health sharing. So just FYI. So what about, are you guys able to see some of the questions that people have?
Yes, so I see one here about a PRA. If, let's say you meet your PRA in a single event and there is more to pay, do you still need to pay the 10% co-share for that one event? So yes, you, depending on which program you select, depending on your PRA, once you've met your PRA, then we kick into a 90-10 co-share. So let's say you've met your PRA with that event and there's a balance, you would be responsible for 10% of the balance and our membership would share into 90%. We do have an annual co-share max, which is $5,000. Once you've met that, we share in at 100%.
And that max, by the way, is per household,
Correct.
not per individual.
Same with the PRA.
Yeah.
Okay, and on that same, along those lines, so for instance, the people who do have health sharing already with another, with other providers like us. So for us, we get 50 visits with the service that we've been using. We get 50 visits, right? Like Cairo visits, but we have to come out of pocket 400 per person before they start covering it. Is there anything like that with Impact regarding the
No, you just have a provider fee, which is similar to what would be like a copay. So you pay that amount that does not apply to your PRA. And then once you've met your PRA, we share at 90-10 up to the $5,000 max. So no, once you've met that, we share at 100%. So no, there is nothing like what you're describing.
Okay, so the PRA would have to be met.
Correct.
Got it. Okay, cool.
What else?
I see
But if a
something.
member chooses not to participate in a share and they terminate their membership, would the termination be a temporary one-time event or a categorical termination? Would the member need to rejoin and start all over with a new start date?
So memberships are they're monthly subscriptions, right? For healthcare in that regard. If they decide to terminate, here's the cool thing that we do that no other healthcare sharing organizations do is after 60 days, you have more than likely some money remaining in your member-owned account. Well, that money is sent back to you. Why? Because it's your money. We embrace the purism of voluntary contributions, right? Of your money, being a good steward of your money. So, but keep in mind, if you leave membership, right? And then something were to happen, an event before you decide to rejoin, that would be considered, depending on the situation, a pre-existing condition.
As well as thing that was shared into during your membership.
Yeah.
Right.
So,
Which is funny because that leads right to the next question that somebody had is what are the pre-existing condition terms? So
pre-existing is any medical condition for which you've gone 36 consecutive months with any one of the following 6 buckets: treatment, signs, symptoms, medication, diagnosis, and testing. So if you've received any one of those 6 things in the previous 36 months, that condition is considered a pre-existing condition, therefore not eligible for sharing. We do have some exceptions in place, and they are as follows. For hypertension or high blood pressure and high cholesterol, if you have either one of those conditions and they are well controlled on medication, which we do use medical records to confirm that, then those 2 would not be considered a pre-existing for any future vascular events. So for example, let's say I have high cholesterol, it's well controlled on medication, it's well documented in my medical records, and I end up with a heart attack. That would not be considered a pre-existing. Now, if your cholesterol was not controlled, then we may say that could be related. We would do some investigation with your medical records. But if it's well controlled, then that's fine. Same for high blood pressure. If you have a stroke, but your blood pressure is controlled with medication, we would not consider that a pre-existing condition as it pertains to the stroke. Now, we do, starting May 1st, we have new provisions in place for cancer. As we understand that there are some people that may have had cancer, it's completely in remission, but they still go annually to get a PET scan or a CAT scan just to make sure that everything is at bay. So for that cancer diagnosis, once you join membership, we would not share into that medical expense for the first 36 months. But after 36 months, if you still have not met any of the other 6 buckets, with the exception of that one surveillance test or diagnostic test that you're receiving, we would then share into that expense, heaven forbid, if that cancer came back. So we do have that stipulation in place. But remember, while we may not be sharing into that CAT scan or that PET scan for those first 36 months, that it would still be eligible for the savings provision to our plan. So you would still get that benefit or that provision. It just would not be eligible for the first 36 months.
And the sharing and the repricing, which we talked about this before we started the call. I just think that's such a big deal that you guys are going to be able to go in, even if and I'm not maybe communicating it accurately, but even something isn't eligible for sharing, it doesn't mean that impact can't make a difference in the billing.
Correct.
Okay.
Yeah, every single bill gets repriced, whether it's eligible for sharing or not. We think that's a key member benefit and
Correct.
providing that member-centric experience. We have people that are members that simply are impact members, and they know their ailment is not eligible for sharing, but they remain in membership simply because of the discounts that we're able to deliver to them.
Yep.
Awesome.
100%. So it's something to take into consideration. Any medical bill that we receive, they will be repriced regardless. And they will be eligible for savings, but not eligible for sharing necessarily, depending. But yeah. Let's see, any
What
other
else?
questions? So something about holistic alternative health approaches instead of Western medicine. So as of right now, we do not have any provisions in place, but we are looking at some options.
Yeah, we're aggressively engaged in that category at the moment. So stay tuned for that. There should be more to talk about in the future on that one.
And then also, while we scroll down here, Washington, what was it? Washington,
Rhode Island and New Jersey, we have elected not to enter as of now. It's just advice from our council, although they are reviewing one of those states at the moment. So stay tuned, hopefully, for something to announce here in the coming month or two.
well, which one of the states? Just so people, which one?
So New Jersey is the one we are actively looking at right now, and I don't want to. I can tell you this: based on some preliminary conversations, I'm encouraged about the feedback from our council.
Great. Okay, very important point, guys. Remember, look, you got to read that's in the information. So 3 states.
There was a couple of questions about social security number versus ITIN number.
Yep. So for non-resident aliens, right? You need that have an ITIN number along with a government issued ID from obviously U.S., Canada, Mexico, and Guatemala. We are able to accept them into membership.
Awesome.
I see one question here about healthy families looking for protection in case of health issues like cancer, big emergencies where you'll need good coverage, how it works. I think we're an excellent option, probably a really great one for healthy families that are looking for some sort of coverage or plan in place for something like that. I'll give you the example. This is a real example of a member that we had. She joined Impact in January 2020, and then unfortunately a few months later was diagnosed with pretty aggressive breast cancer, and that was 100%, well, not 100%, that was eligible for sharing because it was not related to a pre-existing condition. She had no symptoms, no testing, no diagnosis or anything like that prior to. We shared into a large portion of her bill. She met her $5,000 co-share max. So then we were sharing into her bills at 100%. She is now cancer-free, thank God, and doing very well. But we shared into all of her bills over $1 million probably thus far into her bills that we've shared into.
Yeah, one of the cool aspects that you see in our platform is you're able to pray for or encourage those that you've been matched with. Now, we don't tell you what the ailment is, right? That's privacy. We don't violate any HIPAA rules and regulations, but it's just another really cool aspect that the community can, support, the support you can provide within the community, right? Via prayer, via encouragement, whatever, should you choose you want to. So it's always warms my heart when I see those messages and the response back and forth of thanking them for their encouraging words or their prayers.
I don't know if you got to this one. Thanks, Phil. Is two questions. Number one is, she's going so fast. One was the 3 days to participate. Is it voluntary? Is the sharing voluntary? And a question about vision and dental.
Yeah, so vision and dental, we don't have a program for. My understanding is ACN Perks has a terrific offering in there. It's either in there now or about to be for vision and dental. So that's going to be a great way for you to access savings and encourage those families that you're talking to, those leads, to become a IBO simply for those perks like that. So if nothing else, right, if they don't want to earn, income based on, obtaining customers, then the perks program that is getting built and somewhat built already is fantastic in that regard.
While we don't share into vision and dental things, we do share into vision and dental medical diagnosis related to an injury or a medical diagnosis. So for example, you have a cavity, you need a root canal, that's a dental diagnosis, that's not eligible for sharing. But let's say you slip or you fall and you fracture your jaw and you break your tooth, that's a medical diagnosis that would be eligible for sharing. Same for things like cataracts, that's a medical diagnosis that would be eligible for sharing versus say prescription glasses, which is ineligible.
Right. So, and I think the first part of your question, Dean, was based on the voluntary nature of being matched, right? So your choice is when you're matched, we call this publishing. You have 3 days before we pull the money. If for whatever reason you don't want to participate, you want to leave membership, you're able to do that. But you cannot decide what to match or not match in. That's all done through the magic of technology via the algorithms that do all that thinking for us. So.
Great.
All right, let's see what else is there.
Okay. I see one that says I'm accredited. All right, good job.
Oh, I know somebody asked me that regarding the Cairo visits. Do you need a referral, or like can they be, what if they're maintenance? Is that okay?
So you do not need a referral because we don't have a quote unquote network. You can see any provider you want. If you decide you just want to go right to the chiropractor, you can do so. Now, some providers, some specialists may require referrals, which is very unusual, but that's up to your individual provider. But again, it's extremely unusual. And you mentioned maintenance. So if you're going to see a chiropractor, as long as it's related to a eligible medical diagnosis, then sure. So let's say you have a new back ailment, then you want to go see your chiropractor every 6 months just to make sure everything is intact, get your adjustments, then that's eligible for sharing. But let's say you had a back injury prior to joining Impact and you had symptoms within 36 months, then that would be ineligible.
One of the key benefits that she just mentioned that I forgot to was we don't have a network. So you have the freedom to see any doctor you choose. And we think that freedom is very, very powerful and very, very valuable.
Yeah.
Okay. Midwife question. Does it cover midwives instead of hospital birth?
Yes. So we do share into births by midwives, as long as they are licensed in the state in which you are delivering. We would share in home birth because again, we're reimbursing for the cost of the provider. If there are ancillary fees, for example, sometimes if you get like a pool birth and they charge you a fee to rent the pool, that may not be eligible for sharing. But again, the provider fees for the actual delivery are eligible for sharing.
Okay, so I asked this question, guys. So we did 3 water births when our kids were born, and our health sharing covered it. So I asked Dr. Maharaj this question about the water births, if health sharing would cover it. And so what I found out was that it's basically the same thing with the health sharing company that we used. when we had the water births, we actually paid for the midwife and for the birth. That included the birth center, that included the water birth. So that's why they covered the whole thing. It's in how they build it, which is
Yeah, it depends too on how they code it and how they submit their billing too.
Yeah. So that's a big deal. That was the reason we took a close look, because there were certain things that were covered that weren't covered with regular insurance.
Awesome.
And the covered, not covered, I see the fertility, infertility treatments are not eligible. Could that change in the future? Would that be considered eligible in the future possibly?
Yeah, I mean, we're always looking at ways to improve, and we're always taking feedback from our membership. And as I mentioned, our reserves are very healthy. So if we find that that's something that, you know, is a great need, then sure, we're always looking to improve. We're not, that's the beauty of being a not-for-profit, is that we can do things like that. We can make changes like that.
Yeah, if there's enough member feedback, and then it's just a math exercise, we put actuarial numbers to it and see what the risk is and see what our distributed reserves are. And if that is healthy, then we make the decision through the board.
I do see here, this one's a pretty good question that I just want to touch base on. If someone has an ITIN number and an ID from the US, but they're from a country besides Mexico, Guatemala, Canada, then yeah, that more than that, they can join. As long as US ID, the ID is really what, and the ITIN number. So a US ID.
And that's a requirement from our financial partner.
Correct.
Okay, so just so we're clear, because this has come up a lot. So if someone has a tax ID number, ITIN number, and an identification or driver's license from the US, good to go. It's the ID, it's the US ID that's necessary.
Correct.
And the tax ID number, obviously, right? They need a tax ID number or a social security number. Perfect. Now also, if they're Canada, Guatemala, Mexico, they can do it with their passport, ID from one of those countries, and a tax ID number, just so we've got that recorded in there. Okay, cool.
And the other one that I see that's come up a number of times is pre-existing diabetes covered. And I think you may have covered that, but it's been asked a couple times here.
Yeah, so any diagnosis, including diabetes, the only exceptions that we have in place at the moment is for cancer, high blood pressure, and high cholesterol. So if you have diabetes, that would be considered a pre-existing condition, assuming that you're you're getting testing, medications, diagnosis, treatment in the previous 36 months. But those bills would be eligible for repricing. And I'm not by any means condoning anyone do this, but we did have a young gentleman had type 1 diabetes who was paying $1,500 a month for privatized health insurance. He decided to join Impact because he was saving over $1,000 a month, even with our prescription saving plan, not using his insurance. And he's like, listen, my diabetes is pretty controlled. I've had this since I was a kid, and I don't have any issues. I'm never in the hospital related to it. So with the savings alone, I'm going to join Impact. And he's been a member for some time now. So the repricing by itself was so valuable to him that he left his private health insurance to join us.
That's awesome.
Yeah.
Okay.
People, at the end of the day,
guys. Go ahead, Phil.
The only thing I would say at the end of the day, right, the guidelines are what every member or potential member should review, so they completely understand. It's our way of providing transparency on what is an eligible medical expense and what isn't. And then if you have questions beyond that, or you want to talk to the medical director, then you certainly we welcome that as well. But those are our unbiased approach to educating you, providing that transparency on what you can expect as a member to be eligible or not eligible for sharing with Impact.
Mm-hmm.
Okay. And so, as we wind this down, we're getting pretty close to the hour. Two things that I'll ask that I want to know is, what is the average customer, Impact customer, and also what's the average family, right?
When you say
monthly.
Monthly amount?
Mm-hmm.
So our average share amount, when you take individuals and and families and seniors, all that is about $350 a month. When you look at the family, you know, 2 or more, you know, up to 6, I think the average is around 500 and 5 and a quarter, something like that a month.
Fantastic. That's great.
Yeah.
Some great numbers. Okay, fantastic. So, look, Tony Kupas, I said this in Dallas this past weekend. Tony Kupas, 22, 23 years ago, said to me, momentum is created when there's savings. This is clear savings. I mean, this is clear savings. I have saved easily over $100,000 since I've been on health sharing. Easily, way more. I was just doing quick math. There's things I did, you know, hernia for my son when he was a baby, 3 water births, all these visits. I mean, it's clearly I've saved over 100,000. And Dave Ramsey says it best. Money saved is the same as money made, right? So I could say that I've made about $100,000 by having this service. So momentum is created with savings. This is unbelievable. And the second is simplicity. This is super, super simple. We don't have to become health experts here. This information is for our belief,
Right.
not for us to go out and, you know, fire hose people with this information. This is just for our belief so that then we can get a qualified lead and take them to the website and then hand them to the experts and have them explain to, the service. So yeah, we're excited, guys. You know, like I said, biggest revenue that we've ever had in the history of ACN, biggest residuals. And you know what's pretty cool about this service is that you can come from a position of serving, right? You know that you're putting people in a great place. You know that this is the best option for people. And I absolutely love that, because there's people out there that they're not driven by money. They're not driven by residual income. They just want to help people. And this is just fantastic. I mean, this is a dream come true for direct selling. So thank you so much, Phil, Dr. Maharaj, Dean. Is there anything you want to add before we get off, Dr. Maharaj and Phil? Any last minute things that have come up that you think is important?
You know, I appreciate, Efren, your sentiment, right? That this is ACN is doing, no one else is doing this in direct sales. So the power of direct selling in healthcare get to meet through the ACN IBO experience. And that is up to you, right? You get to, as we talked about, you get to help solve the #1 reason families file for bankruptcy today. And that's because medical issues in bills. So you have the power in your hand to not only serve and help others, but also to put you and your family in a position to save and earn, right? And there's nothing wrong with either one of those. So you're built for this moment. I can't wait to further partner with you and see all the good work that we're going to collectively do together. So thank you for, you know, allowing us to spend some time with your organization.
Thank you. We appreciate it. We'll leave it at that. Fantastic. Dean, is there anything you want to add before we wrap it up?
Not at all. Thank you, Dr. Maharaj. Thank you, Phil. Really appreciate your time and spending these few Zooms with us. I know everybody's excited, and I know May 9th is the day for everyone.
Here we go.
Yep.
Get accredited. All right, guys. Have a fantastic day. Thank you so much, guys.
Thank you. Take care.
Thanks, everyone.
Bye-bye.
Bye-bye.